If you think you understand heartburn, you probably want to watch this video because what most people think is really not the case. And I'm going to try to shed some light on those misunderstandings. So when people suffer from heartburn, which is a symptom of GERD, right? GERD stands for gastroesophageal reflux disease. They often turn to antacids. And the implication there is that there's too much stomach acid, right? So the solution must be to reduce the amount of stomach acid through antacids. In other words, raise the pH, right? Higher pH is lower acidity. But the problem with heartburn isn't too much stomach acid. In fact, it's usually the opposite. So if we can just throw that idea out of the way. So there's this false idea that heartburn is caused by too much stomach acid. But another misunderstanding is about the medications that people take to fix it, right? Omeprazole, TUMS, Pepcid. They actually don't stop the reflux. And a lot of people don't understand that. They don't even reduce the number of reflux events. All they do is they raise the pH of what's already coming back up so that the person is kind of less aware of what's happening. So let me repeat that. Antacids don't actually stop the reflux from happening. And this is very well documented in the literature. So meanwhile, that acid that your body's trying to make, it's essential, right? For breaking down protein, for absorbing nutrients, for killing microbes in your food that you swallow, even regulating your blood pressure. So this video is going to unpack the real cause of reflux, how blocking this one key step of acid production can sabotage the rest of your digestion, it can weaken your defenses, and it can set off a cascade of chronic issues that will probably surprise you. And then we're going to talk about what you can do to fix the root problem instead of just taking antacids in perpetuity. So let me show you how this whole system works and what really causes reflux when it goes wrong. So this is your lower esophageal sphincter, or LES. It's a ring of muscle at the bottom of the esophagus, and it functions like a valve. It stays tightly closed to prevent stomach contents, which are highly acidic, from flowing backward into the very sensitive esophagus. Now, when you swallow, that LES, the lower esophageal sphincter, opens briefly to let food in, but then it snaps shut. But in people with reflux, the LES often relaxes spontaneously, and these are called transient lower esophageal sphincter relaxations, or TLESRs. They're the number one reason why people experience reflux. Now, this may seem to be a little bit out of the mainstream belief for some of you, but it's well documented in the literature. So I'll go through some studies to sort of back up what I'm saying. So for example, too much stomach acid usually isn't the issue. There are a lot of studies on this, but we'll just take a look at this one. This study compared people with GERD, right, gastroesophageal reflux disease, to healthy individuals, and they found overall the median pH is slightly higher, in other words, less acidic, in patients with GERD than in normal subjects, indicating that GERD is not primarily a hypersecretory disease. Now, that same paper emphasized the real driver of acid exposure is the function of the LES, remember, the lower esophageal sphincter, not excess acid. They say other factors, such as the status of the LES, have a greater influence on the degree of esophageal acid exposure. And remember those random lower esophageal sphincter relaxations we mentioned earlier? Another paper drives that point home. They say transient lower esophageal sphincter relaxations, or TLESRs, is the major mechanism of gastroesophageal reflux. So let's talk about what stomach acid actually does. So hydrochloric acid is not some design flaw of the body. It has multiple roles. Number one is it sterilizes the food that you eat, killing bacteria and parasites and whatnot. It helps break down proteins by activating an enzyme called pepsin. It signals your pancreas to release digestive enzymes, and it signals your gallbladder to release bile. It also helps the key absorption of nutrients like vitamin B12, iron, magnesium, calcium, and zinc. And it also plays a role in cardiovascular health by converting dietary nitrites to nitric oxide. And nitric oxide is a key regulator of blood pressure. So what happens then if you suppress stomach acid for months or years? Well, we start to see problems with those things that we just talked about, right? We start to see problems in multiple systems. Number one, we see vitamin and mineral deficiencies like B12, iron, magnesium, calcium, which means, in part, we also see increased fracture risk. Maybe because of poor nutrient absorption, but maybe other factors as well. And antacids increase the risk of fractures, right? So this paper concludes, given the widespread use of PPIs, which are proton pump inhibitors, which are antacids, reinforced by frequent inappropriate indications, which is what we want to talk about in this video, physicians should be aware that long-term PPI use is associated with a modest, but rather consistent, increase in the risk of fragility fracture. Consequently, long-term PPI use should be prescribed only in the cases of strong, validated, and recognized indications. Right? So number 3, we have poor protein digestion, which can set the stage for food sensitivities and immune issues. Since the stomach acid is required to break down proteins, right? Antacids will hinder that process, which means that proteins aren't really fully broken down into peptides and amino acids by the time they reach the intestines. And that means that your immune system is much more likely to react to those fully intact proteins in the digestive system in the intestines. And that means higher risk of developing immune system reactions to things like gluten and eggs, and dairy, and others. This paper sums it up nicely in one succinct sentence: antacids and dietary supplements influencing gastric pH increase the risk for sensitization against allergenic food proteins. So number 4 is reduced sterilization, right? The acid in the stomach is partly there to help kill off the microbes that we consume in our diet, right? Antacids increase the pH. In other words, they reduce the acidity, which increases your risk of infection. So this is well documented in a number of studies, but like this one paper that we'll just talk about here, they reviewed 15 other studies and they concluded, by multiple mechanisms, PPIs appear to increase susceptibility to the following bacterial enteropathogens: Salmonella, Campylobacter jejuni, invasive strains of E. coli, vegetative cells of Clostridium difficile, Vibrio cholera, and Listeria. Now, the 5th thing is what we had talked about earlier: impaired nitric oxide production. The use of antacids inhibits the body's ability in the stomach to convert nitrite to nitric oxide, and nitric oxide is really important for blood pressure regulation. So these are not like hypothetical risks. These are well documented, well established in the clinical literature. Now, these drugs are available over the counter, right? So people I guess they just assume that they're harmless. But the FDA recommends like PPIs, the proton pump inhibitors, like omeprazole. These shouldn't be used for more than 14 days in a row, and you shouldn't be using them for more than 3 courses in any given year. And yet, millions of people stay on them daily for years. And there's literally billions of dollars spent on antacids. And GERD is one of the most common diseases in contemporary Western society. And medications for acid suppression are among the most commonly prescribed therapies in the world. So the question then follows, right? If acid isn't the problem, what is? And what can I do about it? And that's the crux of the issue, isn't it? What can I do about it? Well, the answer, unfortunately, isn't a one-size-fits-all solution, since the root cause varies person to person. However, what I'm about to show you is kind of a checklist that you can follow so you can dig into the root cause for you as an individual. So here are some of the most common causes of reflux. Number 1, obesity and pregnancy. They increase the upward pressure on the stomach, right, which puts more pressure on that LES, which promotes more reflux of the stomach contents into the esophagus. Now, obviously, Pregnancy is something that is temporary, and it's something that should be celebrated, right? While obesity is neither. So addressing that would be a good first step. Another cause is a hiatal hernia, right? It pushes the top of the stomach up through the diaphragm, which alters the mechanics of that LES, right? That lower esophageal sphincter muscle that we talked about. Now, the best thing to test for that is something called a high resolution manometry. It's a test where a very thin, pressure sensitive tube is gently passed through your nose, down your esophagus, into your stomach. And as you swallow, it measures the pressure and coordination of the muscle contractions in the esophagus. It gives a detailed map of how your esophagus moves and whether the LES is staying shut like it should, or if it's relaxing when it shouldn't, right? The third one, and I think this is probably the most common one, is impaired lower esophageal sphincter function, right? Those transient lower esophageal sphincter relaxations that we talked about earlier, along with just sort of low tone in the LES, are probably the primary mechanisms for reflux. So these functional abnormalities allow gastric contents or stomach contents to enter the esophagus more easily, right? Especially in the absence of anatomic defects like a hiatal hernia. So again, this can be tested with the same manometry study that we talked about earlier. However, one thing that you have to keep in mind is the LES is controlled by the vagus nerve. Now, the vagus nerve is primarily parasympathetic, right? So it's inhibited by stress, like the function of the nerve is inhibited by stress, which means the function of the LES is inhibited by stress. So various mindfulness practices, relaxation, breathing techniques are appropriate here, as well as just eating slowly, right? I made a video on this a while ago called Mindful Eating, so I'll leave a link in the description below if you can take the time to watch that one. Now, the last cause that I want to mention here, again, it may seem a little bit out of the mainstream, but it's too little stomach acid, right? LES tone, the lower esophageal sphincter tone, is partly regulated by the pH of the stomach. So when the pH of the stomach is low, in other words, it's more acidic, then the tone of the LES increases, right? And when the pH is too high, in other words, there isn't enough stomach acid, the result is less tone in the LES, which means more reflux coming back up. It was kind of funny recently, Senator Ron Johnson actually explained how he uses a hydrochloric acid pill before every meal, and he no longer has heartburn. Now, that video is too long to post in this video, but you can scan this QR code and watch it on your own time. But I would really suggest that you don't just start randomly taking a hydrochloric acid pill without having it under the supervision of some sort of healthcare provider, right? Now, there are various causes why someone would have too little stomach acid, ranging from like autoimmune gastritis to H. pylori infections. And there's specific tests that I typically order on my patients to figure out what we're dealing with that, right? But the overall theme here is if you've been relying on antacids or PPIs or whatever you want to call it for months or years, it's probably time to ask, what is the real issue, right? So consider a manometry test, an H. pylori breath test, antibody testing for autoimmune gastritis, maybe losing a little bit of weight, maybe undergoing some stress reduction techniques or mindful eating, right? Or whatever it is that may be at the root of your heartburn. Because, you know, acid reflux is complex, but it is treatable, but not just by staying on antacids in perpetuity. It's time to stop masking the symptoms and start listening to what's going on. So, I mean, the last video that I put out was all about how most of the top selling drugs in the USA are all built around this premise of suppressing, blocking, or inhibiting some aspect of your physiology. And there's no curiosity as far as why people have these conditions to begin with, right? So this topic of GERD or heartburn certainly fits that bill. So you have to remember that your gut is smarter than you think, right? So let's stop suppressing it and start supporting it. So if this video gave you some sort of new perspective on reflux or heartburn, please like it, share it, and drop a comment below if this is something that you've been struggling with. Thanks.